Good morning, boys and girls. This is Mr. S with your Chapter 14 review on stress and health. And right from the get-go, do not get stressed over this test. You should know this. 30 questions. Let's go through it. You need to know definitions, and there's at least 2 to 4 questions that state the text defines stress as, the text defines, so please make sure you know your textual definitions. Look at all the terms in the book. Read the chapter. It's interesting. So, what is stress? Know the idea how stress is how we perceive and respond to events that threaten or challenge us. Know what stressors are, those changes in environment that threaten or challenge us. It is then our stress appraisal that is the last component of what really stress is. It's how we appraise and cope with environmental threats and challenges. Fight or flight. Stress is not an actual thing. It is a response. When we talk about the stress response, we talked about the relaxation response. And please know it. Look at the idea of how stress starts to affect us physiologically. For example, those that live in stressful situations, in poverty, lower socioeconomics, urban dwellings of poverty tend to have medical conditions like high blood pressure. Along those same lines, we talked quite a bit about personality types. Type A, Type B. Please know the difference. There are at least 3 to 5 questions on that, so please know it. We looked at the physiological, the idea of our immune system and stress. So look at, for example, how macrophage and lymphocytes are major agents of the immune system. If you remember, there was a slide that said Lesotho, from Lesotho, Africa, and about AIDS and AIDS awareness and AIDS education. And today, more people die in Africa from AIDS than diseases, say, for example, like strokes or cancer or heart disease. And AIDS is something that can totally be prevented if given the resources. And the problem is they do not have the resources. That's why world organizations are trying to help them with these resources, but we deal with also cultural, religious, social issues that make it much more difficult. That leads us to the idea of control. And we talked about rats. And we talked about rats in 2 ways in this chapter. One was the conditioning, and how earlier we talked about with the sweetened water and aversion, how we conditioned rats. The same thing they've tried to use with our immune systems. Then we looked at the 3 rats, the executive rat, the subordinate rat, and the control rat. Look at that study and how the executive rat was less likely to get ill. And the whole idea of our role of control. That's why, for example, nursing homes, people tend to die sooner in nursing homes than when they're living more on their own independently. They'll live longer on their own. Because when you live in a nursing home, they tell you when to eat, what to do, how to do it, and they slowly die. We looked at personality styles or explanatory styles, optimistic versus pessimistic. Please know the difference. And some of the byproducts or personality characteristics that go into these personality types. We looked at the idea of exercise, aerobic exercise, how it can in mice produce new brain cells, how people felt much better scoring on depression scores and tests. We looked at biofeedback and muscle tension, and think of the Tibetan monks and the Tumo yoga. Then we talked about alternative medicine, herbal medicine, homeopathic medicine, and again, one thing that they have found, studies and surveys and anecdotes, and as I give in my examples with alternative medicine, it does seem or can reduce symptoms for certain illnesses or conditions that are much more of a nerve or sensitivity base that you gauge, but they does not seem to have quite the same effect on actual disease, let's say like cancer, where it's going to reduce size of tumors, and something that's much more measurable than, let's say, something like arthritis that is much more subjective, and a tumor which is much more objective, and alternative medicine seems to work better for subjective. Probably the best way I could put it to you. Smoking. A few questions about smoking, why we smoke, even though knowing it's not good for us as a stress reinforcer to relieve stress, and the addictiveness of it, socialization of it, those kind of things. And then finally, the idea of obesity and health. And two things to remember with obesity. One, genetic factors. For example, leptin. Genetic gene defects can cause, in mice, and we've seen in humans, inability to produce leptin. And we'll have obese mice, versus obesity from overindulgence of high calorie intake and less expenditure of calorie. Two things to think about from a historical perspective, us as humans, and especially Western humans, is compared to over 100 years ago, the early 1900s, we were eating less calories and expending more. Today we eat higher calories and more calories and expend less. But today, compared to 40, 50 years ago, we are less likely to smoke and more likely to be obese. And one of the things that can be accredited or looked at this from different perspectives could be, once the medical community, the social community, and society attacked smoking, and to where basically, in many cases, the public perception is smoking bad, then we can see why more people are less likely to smoke today, versus obesity hasn't quite gotten to that level yet. And until the medical community, society, socially, culturally, and so forth